Dear students, after introduction, now we are going to see the divisions of the chest wall, and in that, the first division is the rib cage. Now we'll see the rib cage. Okay, the rib cage consists of 12 pairs of ribs, the thoracic vertebra on the posterior side, and to which the ribs are attached, and also anteriorly it is having another bone called sternum. All these are interrelated with some joints or linkages forming a closed kinematic chain. Okay, the thoracic vertebrae forms the base for the rib cage, and this one is the least mobile and consequently the most stable section of the vertebral column also. The ribs articulate posteriorly with the bodies and also the transverse processes forming costovertebral and costotransverse joints. Okay, now we will see the borders of the rib cage. So anterior border is formed by the sternum. The sternum includes manubrium, body as well as the xiphoid process. And the lateral borders are formed by the ribs. And coming to the superior border is formed by the jugular notch and also the superior surfaces of the first rib and also with that of the corresponding thoracic vertebrae forms the superior border. And the posterior border is formed by the thoracic vertebrae, and the inferior border is formed by the costal cartilages, corresponding costal cartilages from 7th to 10th, and also with the lower borders, inferior borders of the 11th and 12th rib and 12th thoracic vertebrae forms the inferior border of the rib cage. Okay, these are the borders of the rib cage. Now we'll see the ribs in detail. So there are 12 pairs of ribs, on each side 12 ribs, forming the greater part of the thoracic skeleton. Okay, and the ribs are bony arches arranged one below the other. The gaps between the ribs are called as intercostal spaces. The spaces are deeper in front than behind. Okay, and also deeper between the upper than between the lower lips. Okay, again, the spaces are deeper in front than behind and deeper between the upper than in the lower ribs. Okay, so this is the arrangement of ribs, and also these ribs are placed obliquely. The upper ribs are being less oblique than the lower. So the obliquity reaches maximum at the 9th rib and thereafter it gradually decreases. So the length of the ribs increases from 1st to 7th ribs and then gradually decreases from 7th to 12th ribs. Okay, the first ribs which are connected through their cartilages to the sternum are called as true ribs or also called as vertebrosternal joints. Up to 7th, these are called as vertebrosternal ribs and also called as vertebrosternal joints also. The remaining are false ribs. Okay, out of these 8th, 9th and 10th ribs are joined to the next higher cartilages. So these are called as vertebrochondral joints, and these vertebrochondral joints, so these ribs are not directly attached with the sternum through their costal cartilages. They are attached with the cartilages of the higher higher costal cartilages, forming vertebrochondral ribs. These are called false ribs. 1 to 7 are called true ribs, and next 3 ribs are called as false ribs. And also the last two ribs are called this one 11th and 12th ribs are called as floating ribs. Anteriorly it doesn't have any connection, only posteriorly it is having connection or attachment with the thoracic vertebrae. These are called as vertebral ribs, and these are called as floating ribs. So this is about the ribs, and in that also the first rib and last two ribs, or each rib is articulating with a single vertebrae, whereas from second to ninth ribs are articulating with the two vertebral bodies. Okay, for example, if you take the second rib, so if you take the second rib, here you can see the second rib. The second rib having two facets, superior facet. The head of the rib is having two facets, superior as well as the inferior. The superior facet of the neck articulates with the higher vertebrae, and the inferior facet is articulating with the corresponding vertebrae. Okay, this is forming costovertebral joints. Normally from second to ninth ribs are called as typical ribs. In some books it has given that from third to ninth are called as typical ribs, but both are same. You can consider it anyway. So from second to ninth is right, or from third to ninth is also right. Okay, so this is about the arrangement of ribs in the rib cage. Okay, and in front, anteriorly, so anteriorly the sternum provides an osseous protective plate for the heart and is composed of manubrium body and the xiphoid process. Okay, so this is giving protection to the heart anteriorly. Now, so there are different kinds of joints present in the rib cage. So we'll see an overlook of it. So here we can see the joints of the rib cage are, so if you take the sternum, so sternum is having manubrium body and the xiphoid process. A joint between the manubrium and the sternum is called as manubriosternal joint, and a joint between the body and the xiphoid process is called as xiphisternal joint, and it is also having a joint with that of the clavicle. So it is having a clavicular facet for the articulation of medial side of the clavicle to form sternoclavicular joint, and it is also articulating the sternum as a whole is having 7 facets to give articulation with the 7 costal cartilages of 7 ribs, forming costovertebral joints. So posteriorly it is forming costovertebral joints. So this is called as sternochondral joints. This is called sternochondral joints. Posteriorly it is called as costovertebral joints. So here it is, the sternum is articulating with the costal cartilages, so it is called as sternochondral joints. What do you call? Sternochondral joints. These are sternochondral joints. And this cartilage, here you can see the cartilage is articulating with the ribs, so that such kind of joints are called as chondro costochondral joints. What you call? Costochondral joints. And if you can see in the lower ribs, so the lower ribs, so from 8th, 9th and 10th, or 8th, 9th and 10th are articulating with the higher cartilages by another cartilage that is called as, it is forming a joint between the superior rib as well as the corresponding rib, forming interchondral joints. What is that? Interchondral joints. So these are the types of joints present on the anterior aspect of the rib cage. So what are the joints present in the anterior aspect? So again we will see. So the first one is the manubriosternal joint and jiphisternal joints, and sternoclavicular joints, and sternocostal joint, and costochondral joints and interchondral joints are present on the anterior aspect. If you come to the posterior aspect, you can see the costovertebral joint as well as the costotransverse joints. So these are the articulations present in the rib cage.